right now. Hold that thought.
Okay. Gotcha.
Hi, I'm Dr. David Warwick, Warwick Chiropractic, and today we have David in here, coming in for a tune-up, and David happens to work at one of the largest mattress companies in the area, Pacific Northwest?
Yes, sir.
Is that, and that's Sealy, right?
Yes.
So, if you're having some back pain, maybe it's time to change a mattress and find the right one that works for you. David actually builds them, and you'll see his name on some of the, I thought signature or the top of the line stuff. Is that correct? Or
Yes.
and yeah, that's what I thought. So, you know, when you spend 1/3 of your life in bed, and your body does most of its healing at night, there is one important thing that I share, or a couple important things that I share with patients. Don't sacrifice on a good mattress or a good pillow so you get a good night's rest. All right, David, short right leg, about a good inch on that right side. Goes a little shorter. So David came in, usual areas, but he's got a little kink in the neck as well. He tends to work on one side more than the other, and so doing something repetitive when building either the mattress, the box spring, and or both when he's on that. This is actually your slow time.
Yes.
It is. And he was sharing with me that I think at your peak time you guys will be up over 700 a day?
Yeah, close to 900.
900 a day mattresses being made. So a lot of bodies on those mattresses. Okay, lay on this side. Pretty amazing. Bend right here.
My favorite one.
Yeah. There it is. You did great on that one. Face down. That's because you're on camera. Nose in the hole, face down.
Oh, yeah.
Rotate. Hey, you did great on that. Usually I'll tighten up on that one. Then it kills my back and I gotta go to my chiropractor after you. Now, William was saying it's a pretty decent place to work as well, so you have too. You've been there now a few years?
Going on 4.
4. Up for promotion. Good for you.
I'm multi-skill. I was already, I'm lead sometimes.
Are you heading into like supervisory?
Oh, I'd love to. My boss knows that I want to.
Just a matter of time for
Yeah.
the position. Yeah. Good. Well, we put that out on Facebook, so we're putting that live. Hey, you might be the right candidate for the next open position there.
And I actually trained Will.
Did you?
On the position where he's at.
Yeah, he talks highly of you. I don't know. We haven't had a conversation about you behind closed doors, though. So.
Yeah, I call him my prodigy because he's the only one that paid attention when I trained him on the bagging machines.
Well, everybody starts somewhere, you know, and people that are above you obviously usually got there because they did something and earned that place. Well, hopefully most everyone. Okay, I'm going to have you lay on your back. Okay, so bend your knees, feet on the table. We're going to cross your arms right here. Yeah, I'd asked Will if you guys do any warm-ups before getting started at work. Breath in, blow out. Good. And he said you did have a little shift that you do. Did you feel that?
Yeah.
Good job. All right, because of what he does, a lot of lifting and twisting of the mattress, huge amount of repetitive type strain. I imagine most of the guys that are in at Sealy, same kind of thing. So big chance of injury, but you got to reduce that. And one of the ways that David's been doing that is getting adjusted. You feel more of that kink on the left side or the right side?
It's when I turn my head to the left.
Feel that right there? So I'm going to adjust that area. So I want you to go ahead and push your left ear into my hand right here. And relax it. Drop your right arm to the floor. There we go. Good. Go a little further down. Good. Push again, push again. Relax, don't drop the arm, put the feet down. Thank you. See, you were on to me, David. You're a smart, quick guy. Lift your head, back down. Looks like your Van Dyke, Fu Manchu type beard here is getting a little longer.
It is.
Elbow down, there we go. And the other one. Drop down. Good. Alright. Tip your right ear to your right shoulder. Left ear to left shoulder. And back to the middle. Where you felt it on this side? Right in there. There. Okay. Alright, so turn your head to the right. And back to the middle. Turn it to the left. Back to the middle. Okay. Tip your head to the right. And gently push your head into my fingers right here. Gently. And relax. It's a stretch I want you to do. Again. And relax. Bring it back up slowly. Turn your head to the left, just a quarter turn right there. Bend it forward for me. Push into my hands gently. And relax. Alright, turn it right. Turn it left. Back to the middle. Was that a little better?
A little bit better.
Okay, tip your head to the right again. Now I want you to try to bring your left ear and left shoulder together at the same time, which is 10% of your strength. David's 10, maybe some of your guys a lot more. And slowly relax. Try it again for me. And relax. And back to the middle. Okay. Nice arch into the lower back. Bring your shoulder blades back. That's aligned. Now retract the chin, so bring it back like this. Not down. Just draw it back, straight back. So the ear is closer to alignment with the shoulder, with the hips. That's your normal, healthy posture. Take a deep breath all the way into your nose, out your mouth. Do that 3 times. Good. Get that chin retracted back. Good. And relax. So David, there's a couple things that you do. Work on that. When you come to a red light, just simply draw the chin back. You know, you can do that one stretch I showed you with extending the head back, pinching the shoulder blades back. Really key for you because your work tends to be in a downward or a lot of movement, forward type position. Move around, see if that feels better. Any words of wisdom to the crew out there?
Get a good quality bed. It makes a big difference. If you have to spend a little bit more money, it is worth it. I sleep on a Stearns & Foster, and I just recently got the bed about a month ago, and I've noticed a big difference. Dr. Warwick is excellent for adjustments. If you need to go see him for any kind of work, I highly recommend him.
Thank you. All right, talk to you guys later.